Some of the factors that affect the ability or having health care coverage: race. In Stark County, 12% of the white population is uninsured. 19.5% of the minority population is uninsured. Income: 21.1% of individuals with incomes less than $18,000 are uninsured. 18.4% of incomes $18,000 to $36,000 are uninsured. Once you get up to $54,000 or above, there's only 6.5% who are uninsured. Age is a factor. Among individuals 18 to 24 years of age, 34.1% are uninsured. 35 to 44, 19.1, and then of course when we hit 65 because of Medicare, 65 and older, only 3.8% are uninsured. And employment obviously is a critical factor in having health care coverage. 12.6% of full-time workers are uninsured. 21.3% of part-time employed workers are uninsured, and 32.1%, a third of unemployed individuals are uninsured. What's the impact of being uninsured? There's been lots of research, and the research shows that basically one of the factors in being uninsured means that the kind of care you have is crisis care. That primarily whenever you're uninsured, you don't go early to take care of an issue, you don't go regularly to a primary care home, you go to the emergency room. And you go to the emergency room or you go to a doctor when something is wrong. And that's the only time you go to a doctor.
Statistically, the more money you make, the more educated you are, the more likely you are to get those preventive screening tests and to keep you healthy. That being said, however, even if you are a well-educated person of color, you are more likely to, at some point in your life, have been poor and to not have had access to routine health care. And so I would say that the disparities that we've talked about are access issues, even when we look at those of us in this room who are highly educated, hopefully highly compensated. If you have not grown up with the idea that you go to the doctor every year for your checkup as a little kid, you're less likely to go to the doctor every year for a checkup as a grown-up. If you don't know that your doctor should be asking you, did you have your mammogram this year? You know, you're 50, we need to practice, or we need to schedule you for sigmoidoscopy. You're not going to know that he should be asking that, he or she, and prompting them if they forget. And so you're less likely to get those tests, those services, that nagging, lose weight, stop smoking, exercise more, that's going to keep you healthy. So we need to work on access from the very beginning so that people are learning what they should be expecting, so that they're starting when things are early stages. If they're not preventable, we at least catch them early and treat them.
Healthcare disparities basically represents measurable differences in disease incidence, morbidity, and mortality. And if you look at the case of minority populations, minorities differ from the majority in the incidence of the disease patterns and different healthcare utilization patterns, and a disproportionate burden of what we call healthcare disparities is borne out, especially in African American populations. So in essence, the overall health of the nation really differs by the race or ethnicity of the communities and individuals in question. Regarding healthcare disparities, here's a statement from Dr. David Satcher, former U.S. Surgeon General, about healthcare disparities, and just to demonstrate the impact that healthcare disparities have on the United States. More than 886,000 deaths could have been prevented between the years of 1991 to 2000 if African Americans had received the same care as whites. And this was published in an article in the American Journal of Public Health. And basically the synopsis of this article and the conclusions of this article was that if African American populations just received the same quality of health care as the majority population, this could have averted 886,000 deaths over a 10-year period. Despite improvements in advances in medical technology, it basically comes down to our ability or inability to actually deliver that medical care and that technology which is available to those patients and populations and communities in need. So it's really translating that medical knowledge and know-how out to the people who really need to be affected by that new technology.
I'm here with Patty Fetzer from Community Services, and she was one of the facilitators of the event here today, the Minority Health Symposium. And what are some of the important things that you're seeing as far as disparities in healthcare today?
I think number one, it's access to insurance, and number two, it's just feeling comfortable with going into any of the healthcare centers, whether it's for mental health treatment or physical health treatment. And then number three, the biggest thing in the population that I do a lot of focus with lately is with young people, and they, number one, most of them do not have health coverage, and number two, many of them do not feel comfortable accessing the different treatment options that are available. And with all the different cultures, and some of the talk that we had today is to make sure that we have people of different cultures, of the people we're serving on our staffs, wherever we're working. So whether they need to be young, African American, Asian American, Hispanic, we need to have a variety of people on our staff to help the other people feel comfortable coming into our centers.
The young people do not have the insurance coverage. The young people, when you talk mental illness or physical, a lot of the illnesses actually start and really hit hard around the age of 17, 18, and 19. If we can get them in to treatment and treatment that they agree with at an earlier age, there's such a much better prognosis on so many levels. So we're really working hard to do that. Transportation is a major issue for young people. The cost of gas and everything that goes with that is major. Many young people do not have access to the cars. But the young people are accessing the world and the media so much differently than I am, and I'm still learning it. But they're texting, and they're using MySpace, and they're using Facebook. But as we as service providers, we're still using the old-fashioned phones, the old-fashioned voicemail, and the old-fashioned email. And they're not, and I've learned this even from my own teenage kids, they don't check email anymore, and they certainly don't check that voicemail that's on the home phone when they come home. So they're not getting those messages. If we're trying to remind them of their appointments and things like that, we really need to look at that. But I want you to be aware that locally we are working in partnership with young people on increasing access to services. And then at the state level, we are, with the Ohio Department of Mental Health, working on it.
Often you talk about, your office is the last stop for many people, but you see a lot. And what advice could you give to young people, especially when you see the young person come in on your table because of violence way too soon? What could be done about those things?
I think for the young person coming to my office on a stretcher, it's too late. But as a Stark County coroner, I believe it would be one of my pleasant duties to talk to the young people wherever you are, whatever the location is, your basement, church basement, or house, or a school. I'll be more than happy to talk to young people and say guns, drugs, and violence is no good, because sooner or later you'll be coming to my office on a stretcher. On the other hand, education, improvement, and social responsibility, get a better job.